Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Rakta Pitta and I have put a point that there is internal bleeding without any trauma, but this internal bleeding is limited to some organs like brain, etc. And we have not seen this bleeding externally through any orifices. So, how we can tackle this patient or we can make the samprati of these patients? Now, remember that this is Rakta Pitta only because there was Rakta Strav inside the body. But many a times patient come to you with the reports of CT scan, MRI where there is shown the hemorrhage in some area of the brain like that, and they are expecting us to have a treatment. Now this is bleeding internally, so we can name it as Rakta Pitta, but when you are seeing the patient after a certain period where actual samprati happened, actual hemorrhage happened, what is the present condition of the patient should be keep in mind. Should be kept in the mind. What I mean, when you are bleeding, the patient is bleeding actively, Rakta Stambhan is no doubt the Chikitsa Sutra. Now, there is internal bleeding which has happened some days back. Patient has come to you with the report and he is expecting you to resolve this problem. Now, what is the status? Hemorrhage, yes, hemorrhage was happened, right? It was happened few days back, and now at present you will find that these, for example, I am just for your reference I have drawn this figure that these are the arteries where there was hemorrhage at that time. Okay, this thing is happened few days back. Now what is, you had named it as Rakta Pitta because it was hemorrhage. Now what is the present condition of this patient, of this artery area? There is a bleeding seen, but this is the clotted blood now. This blood is now clotted, it is already the Stambhan Avastha. It is not the flow, free flow of the blood, it is the clotted blood, whatever they can name is as infarcts, ischemia, etc. Now patient is expecting to resolve this problem, and the question is how you will think of this samprati. Hetu was bleeding condition Rakta Pitta. Patient is come to you with the condition in the artery where blood is clotted. There is no active bleeding when you are seeing this report after certain days. Always remember. So, though the diagnosis is Rakta Pitta, you have to think it differently. And what is that? In the Rakta Pitta Chikitsa, there is a very important sutra, Askande Raktam Skandayet. It means you should give Rakta Stambhan Chikitsa in those patients where there is bleeding, Askande Raktayet. The condition where already there is Rakta Skandan, already there is clotted blood, if you give Stambhan Chikitsa here, what will happen? It will increase this clotting and samprati at present will get boost. Samprati will be more intensified because there is already clotted blood and you are adding Rakta Stambhan Chikitsa in these patients. I have seen many Vaidyas making this type of treatment of Rakta Stambhan when the reports are there is hemorrhagic patches in some area, whatever the organ may be, just because hemorrhage means Ratta Pitta and Ratta Pitta means Stambha Chikitsa. Always remember, at this avastha, there is no active bleeding. The blood is already clotted. If you give Ratta Stambha Chikitsa in this patient, it will add to this clotting, and the blood supply which if it is hampered above this area will be hampered more and more. Hence, always remember, askande raktam skandayet. Hemorrhage is there, but it is already thrombosed. Now the question is, what is the chikitsa for this? In this case, you have to think how this clotted blood will be get removed, and so that when this aurole of the clotted blood in the arteries is removed, then only the blood supply to the further area will be established. And hence, in this case, for this Rakta Skandana avastha, you have to give the medicines which are able to break this srotorod in the arteries by the clotted blood, and hence you have to give the Bhedan Chikitsa. Understand? You have to give the blood flow is obstructed by the clotted blood itself. Blood supply is obstructed by the clotted blood and there is no blood flow to further area. You have to give the Bhedan Chikitsa in such patients, so that this avrodha by Rakta itself will be cleared and the blood supply will be restored to the further area. I am telling you this again and again because many a times the mistake is done in the practice, that in such hemorrhagic conditions where there is already blood is clotted, just because it is hemorrhage, it is named as Ratta Pitta, nothing wrong in that, but Chikitsa of Ratta Pitta is not indicated in these patients. Then the question remains that if you have to clear this pathway, then you have to make the Bhedan Chikitsa. How we can establish this Bhedan Chikitsa, we will discuss in the next lecture. I will be happy to hear your views on this my aspect of hemorrhagic conditions. Thank you very much.